Hi, I'm Dr. NGYN and I have a clinic in Portland, Oregon. I'm going to talk about what to do about your heavy periods. A frequent question I have from women is, my periods have gotten out of control, I bleed through pads an hour, or I soak my sheets, or my bathroom looks like a crime scene, and I want to do something about it. There are lots of choices that women can make, starting with over-the-counter NSAIDs, ibuprofen, Aleve products can lower the amount of bleeding that you're having. If over-the-counter agents don't work, we can try hormonal agents to help, which include low-dose birth control pills, a progesterone-only birth control pill, or an implantable birth control pill option or injections. If women don't want to take hormones to control their periods, there are some minimally invasive things we can do before we talk about surgery. The first of which is use of the Mirena Iud. I'm holding an IUD in my hand right now. It is an intrauterine device that we insert in the office setting with a little topical lidocaine. There's minimal cramping for less than 30 seconds. And what it does is it produces a hormone, progesterone, in the lining of the uterus, keeps it from getting too thick, so the periods either go away or get a lot lighter to be panty liner periods. If the Mirena lasts 5 years, then it can be put in again and again until menopause arrives. If the Mirena isn't helping, we can also do an outpatient procedure called ablation, where I put a device in the uterus that cauterizes the lining of the uterus, so that, in a sense, if you don't grow grass on your lawn, you don't have to mow the lawn. So the ablation actually cauterizes the lining so that it doesn't grow back every month. And 80 to 90% of women either have very light periods or no periods at all following the ablation. It's a 30-minute outpatient procedure that does require some pain medications, but is very manageable. And finally, an option that's very popular is a minimally invasive hysterectomy. Hysterectomies come in all varieties, but the minimally invasive procedures are done through the umbilicus, or the belly button. We use a camera to look at the uterus. We want to preserve the ovaries, since that's where the hormones are, so you won't be menopausal. But we are now able to remove the top of the uterus, or the uterus and cervix, through an outpatient procedure. Women go home the same day or the next day. They're back to work within a week, and they have no more periods, and their hormones are not affected because we haven't removed the ovaries. So it's a wonderful alternative if women are willing to go through surgery to remove the uterus itself. There are a lot of options to manage very heavy periods that are affecting your quality of life. I hope you'll give us a call.